You know, next month may be Heart Month, and that is not necessarily Valentine's Day, but it does tie together a healthy, happy heart, of course. But keeping the heart healthy is a year-round proposition. Dr. William Cooper is with us, heart surgeon with Life Supplemented Wellness Program. That is what he's going to be talking about, and the 3 pillars to heart health. Doctor, thank you for being here. 3 pillars. What's number 1? Have a heart.
Thank you. That is number 1. I hope we all have one. Thank you, Tanya and Lou. Good to be with you. The Life Supplemented campaign is about consumer awareness of health and wellness. There are 3 pillars, and we consider those to be exercise on a daily basis, responsible use of supplements, and following a healthy diet.
Doctor, are we making any headway, before we go to pillar number 2, are we making any headway with people being wiser about their heart health?
Yeah, I think we are. And I think it's, especially in tough economic times, there's never a better time than now to be healthy. So I think the fact of the matter is this campaign has been put together to try to do just that, to get the awareness out there that you can in fact achieve overall health and wellness. And if you do that and focus on that, then that's going to benefit your heart tremendously in the long run.
Doctor, what do you mean using supplements responsibly?
Oh, good question, Tanya. What we mean by that is first opening the channels of communication with your physician, talking to your doctor about these things. It's important to note that supplement use is mainstream. 150 million people a year use supplements. And in fact, in one of our surveys, we found that almost 60% of heart specialists actually use supplements, and 72% of those recommend them to their patients. So it's opening those channels of communication so that you begin to understand that they do play a very important role in overall health and wellness, and that ultimately will lead to heart health.
Doctor, when you say supplements, define what a supplement is, and are the pharmaceuticals really shoving that down our throat, if you might say?
Yeah, I hope they aren't shoving it down our throats, but we're looking at and talking about some of the more mainstream products out there, like multivitamins, for example. Okay. And when we look at our survey and we looked at the number of cardiologists who are taking supplements and who recommend them to their patients, the number 1 things on their list are the multivitamins, the omega-3 fish oils, the vitamins B and C, and also calcium. I personally take a multivitamin every day, omega-3 fish oils, as well as a fiber supplement.
Now, vitamin E is also beneficial to the heart, is it not?
Yeah, there is. I think it's very important when you start to focus on specific and particular vitamin supplements that you look at the full body of evidence. And there's a lot of evidence out there to suggest that, in fact, the antioxidant effects of vitamins C and E are beneficial. But I don't think it should be, you shouldn't look at it in the context of an either-or, and the or being as an alternative, but a complement, a supplement to doing all those other things that you can do to be healthy. I
have just learned recently something we forget about with our heart is magnesium, vital, critical, crucial for heart health.
Yes, absolutely. And so, and the other thing to realize with things like magnesium and some of the other elemental type supplements is that they're very important with regulating how the heart beats and how the heart works on a minute-to-minute basis. So we're talking about calcium, magnesium, and potassium.
Always take those 3 together, or at least the first 2 together, correct?
Yeah, I mean, that's great. And in fact, you will find most of those in most of your general, well-accepted multivitamin type supplements.
Yeah. Are together, exactly.
Yeah. Yes.
Pillar number 2, doctor, what is it?
The pillar number 2, we sort of talked about a little bit about the exercises, number 1. Pillar number 2 is actually the supplements. And then the 3rd pillar is the healthy diet. Okay, you can't uncouple these things. They have to be done simultaneously and all together. And so when we talk about a diet, most of us follow a typical American diet, which is a high-fat, low nutrient or fiber type diets. And so we have to really focus on what we're eating throughout the day and just pay a little bit more attention to that.
I've heard lately that the banana is a marvelous, marvelous fruit that does more than we think it does. Does it help the heart as well?
Absolutely. And in particular, bananas are a great source of one of the things I've mentioned here already that I'm a fan of, and that is fiber. But the problem is, if you look at a typical American diet, we only get about 10 to 15 grams of fiber a day, and the recommendation is that you get upwards of almost 40 grams a day of fiber. So that's a lot of bananas when you consider that most. So we'd be eating a lot of bananas, Lou, if we were going to try to just use bananas. So that's why I think these supplements play an important role.
You know, you really should investigate fiber, because the foods that you think have high fiber don't, and the foods that you least suspect have fiber.
Yeah, be very careful, because a lot of them, in fact, will have a lot of sugars, which are sugars that are not necessarily a diet or a fiber type sugar, if you will.
Yeah.
So be very careful with that, and make sure that you read the labels. Do your research. The internet is out there. There's tons of information. Our website, the www.lifesupplemented.org, is a great website. We've got a great tool there, a My Wellness scorecard. Takes about 5 minutes, gives you an idea of where you are now. You can come back to it later and monitor your progress.
Doctor, let's get back to exercise for just a moment, because a lot of people think that running is the way to go, and I've heard through in a lot of resource publications that walking is just as good as running. Is that true or false?
Yeah, I think that's absolutely correct. Let's talk about how much you should be doing. The recommendation is 6 days a week, about 30 minutes at a time. And so, you know, that's really, when you look at 168 hours in a week, that's about 2% of your time. As far as running, whatever you engage in, I think it's very important that you focus on getting your heart rate up. Target heart rate. Think about that. Target heart rate, which should be somewhere in the range of about 220 minus your age. So if you're 40, you should be trying to get a target heart rate and maintaining that target heart rate at about 160 to 180. Now that's in pretty good shape. So I would say tone it back a little bit, maybe 140, 150, but use that as your guide. So, and be very careful with high impact things like running, especially outside on pavement.
It's not good on the joints, is it?
No doubt about it. In fact, I recently was a big runner, and I sort of changed my program because of some of the wear and tear on my knees.
You look like you're in fabulous physical shape, though, doctor.
Yeah, I practice what I preach. Tanya.
I can tell.
Absolutely sure. I mean, you know, I would have zero credibility if I didn't look this way. So I'm passionate about it. I have a strong family history for heart disease, and so I want everybody to get the message that they got to get moving. They got to use their supplements appropriately, and they got to follow a healthy diet.
Doctor, great advice. Thank you so very much for taking time this morning to be with us. We appreciate it.
Thank you. It's been fun. Have a great day.
Thank you. Bye-bye. Do you walk 30 minutes a day, 6 days a week?
Actually, you'd be surprised. I actually do. And
6 days a week?
I actually.
You take the dogs for a walk, don't you? Yes.
Thank you.
Yes.
And it's always at least 30 and sometimes longer.
Yeah, that's very
But the reason I asked him that running question is because I was always under the impression years ago that you could only run if you walked. It didn't do you any good, but that's a falsehood.